So, ladies and gentlemen, I feel like um, having to follow Moses to talk about morality, um, and so I will try and change the subject, but connected to what Dr. Kang, Dr. Sahota, and Dr. Rangi said, I'll talk about love, pain, and intensive care, and a little bit about my journey, mostly my scientific and academic journey, but also into the community. So this is, I was inspired in my middle school by this novel by A.J. Cronin, The Green Years. So this is when, still in 10th grade. This is coming to Oxford, getting matriculated, my first month at Oxford. And then here I was part of the research group doing my PhD. And this is my mentor, Professor Al Ainsley Green, who later became Sir Albert Ainsley Green. We were working on some papers. We published the first randomized control trial from University of Oxford, looking at different types of anesthesia for premature babies. And then that followed by another randomized trial on sort of full-term babies. And what was happening at that time was that babies were having surgery done without anesthetic, because people believed that babies are too immature, they don't feel pain, their nerves are not myelinated enough, and so you can cut open their chest or their belly, and they don't really need anything. They would be given a muscle relaxant so the surgeon could do their stuff, and we changed all that. That was a silent revolution that occurred in medicine, and after these two randomized trials were published, the changes started happening in the practice of medicine in anesthesia. So then I focused on what's happening in the ICU, where children and babies were in the newborn ICU for months, sometimes weeks and months, and having many procedures. This led me to present the first scientific rationale that pain does occur. It develops very early in human beings, even during fetal life. The year this was published in the New England Journal, the following year, my daughter was born, Amrit. And when she was a newborn baby in the nursery nurse came and said, we have to check her blood for a metabolic test. And so basically she said, don't worry, she's not going to feel any pain. I said, oh yes, tell me all about it. So we did the first randomized control trial on infants having cardiac surgery, and this was published as a lead article in the very first issue of New England Journal. And what we showed was that by changing the type of anesthetic, at that time mortality was about 25 to 30%, and our for whatever reason and our experimental group, there was no mortality. So during the surgery there was about a 20% mortality of other children, and then that was cut to less than half after we changed our anesthetic procedure. We went on to do many studies on epidemiology of pain in infants, and based on this, we estimate about 10 million medical procedures are done, and 1.2 million surgeries are done per month in newborn infants worldwide. So there's a huge burden of pain, and this was not being recognized because at that time, the definition of pain included you have to report the pain, but obviously no baby can speak for themselves. And so we challenged the definition of pain and identified what is the clinical importance. So moving on through many other clinical trials, I set up the pain neurobiology lab, and over the years have trained many young physicians and postdoctoral fellows who have gone on to, major, like, for example, my fellow Adnan Bhutta is now Chief of Critical Care in Baltimore. I have at least 2 or 3 who have gone on to become department chairs in pediatrics. We, through papers published in Nature Medicine and in Biology of the Neonate, we created a model where we thought that if you have pain or stress in early life, it will change how your development occurs for the rest of your life. So we sort of built this model of, what is normal newborn, what is normal childhood. And then if you get exposed to repetitive pain or you're separated from the mother, both of those things have a major impact on brain development. And so this followed with a series of studies on the long-term effects of pain. And, things that became very famous later on was like gastric suctioning at birth, which showed increases the odds of developing, functional abdominal disorders like irritable bowel syndrome or non-acid dyspepsia syndromes. If you have surgery in the newborn period, that leads to increased pain sensitivity that is lifelong after that. And so there were a number of other studies published showing that if you've been exposed to pain and stress in early life, then your IQ is going to be about 10 or 11 points below that of your peers. So this has brought me to the conclusion that repetitive pain leads to poor neurologic outcomes in premature babies, increased cell death in the brain, abnormal behavior, and increased vulnerability to stress, anxiety, or psychological disorders. On the other hand, there is now enough scientific evidence accumulating that loving, compassionate care actually improves neurologic outcomes, reduces cell death, improves cognition and behavior, and gives these children a much greater ability to cope with stress and anxiety. So this was summarized in a commentary published about almost 10 years ago, which was titled Love, Pain, and Intensive Care. And at the beginning of that commentary in the journal, we published this quote saying, "No activity can give you the joy that service does." This is harboring on Dr. Kang's point. No activity can give us the joy that service does. We should yearn for the chance to console, comfort, encourage, heal. See yourself as another. Feel his joy to be yours, his sorrow to be yours. This is a quote from Sri Satya Sai Baba. So many other professional experiences have occurred. I have served on the boards of several research institutes, was secretary for a Rhodes Scholar selection committee, testified before the U.S. Congress, the House of Commons, the Supreme Courts of New York, Nebraska, California, as a founder president of a free charitable health clinic that we started, a comprehensive medical and dental clinic for people who don't have insurance, and also had the opportunity to lead the proposals for 2 nominations, one for the Nobel Prize, the Peace Prize, and another for the Nobel Prize in Medicine and Physiology, in addition to other international awards that I've been, involved in the nomination process. So what I'd like to, and I've been pestering Dr. Kapani, I'd like to, nominate him for the Nobel Prize in Physics, because he truly needs to be recognized in that sense. So for 2 years, I've been pestering him, and he said, okay, let this 50th anniversary celebrations finish, and then we'll work on the nomination. So the deadline is January 31st of 2018. We will turn in the nomination before then. But it is such a privilege to be working with such a great man, but an extremely humble, unassuming person. Along the way, Vaiguruji has been kind and given several awards and things like that. I'd like to talk about the 21st century, where all of us every person in society should be focused on those first 3 years of age, because that's when life and health begins. That's when long-term behavioral patterns are set up. So now there is evidence to show obesity, cancer, heart attacks, all of these things can occur during pregnancy and in early life. It sets you up for, however, if you look in the last 10 years, children are the most abused, the most tortured demographic in our population. And these are underestimated. These are officially reported estimates. 1.5 million children killed, 4 million disabled, 12 million homeless. And this led Jan Tinbergen, who was the Nobel Prize winner in economics. He says the only war worth fighting is the war against poverty. Which is what all of us need to commit ourselves to. This is very sort of influenced by some of the Native Americans over here, and a Creole Indian chief. He said, only when the last tree has been hewn, the last river has been poisoned, and the last fish has been caught, only then will you realize you cannot eat money. This is such a great wisdom. Another great quote is, the fight against poverty demands a new economic ethic, the economics of unselfishness. So we may not have piles of money. Let us learn to be as generous as Dr. Kapani has been with his wealth, but all of us can be kinder and gentler. If somebody wants to get onto the highway, give him a chance or her a chance to. If you go to the restroom and you see sort of paper napkins strewn on the floor, pick them up, let's put them away. We can still be giving in every moment of our lives. So I want to give the example of two biblical seas. The river Jordan flows into the Dead Sea and the Sea of Galilee. The Dead Sea, water flows in, nothing flows out. This Dead Sea is totally dead. Nothing, not even algae or lichen can survive in this on the Dead Sea. It's the same water that's coming from the same river in the Sea of Galilee. Water flows in, water flows out. There's a rich fauna and flora. There's a support for all the communities around the Sea of Galilee. So let us be like the Sea of Galilee. I'm not preaching Christianity or anything. I'm just saying, let what comes to us, let us share. And that's what our gurus advised. We have to share 10% of our wealth. How many of us are doing that today? So I'll finish with this poem, which was written about 10 years ago when we were in Arkansas. My family and I were the only Sikh family in the entire state of Arkansas. I used to joke with my dad. His name is Jaswant Singh Anand. I said, Dad, you may be Jaswant Singh, but I'm just one Singh in the state of Arkansas. So this is going to your point, Dr. Sohota. What is this life so full of stress? We have no time for tenderness, no time to call the ones we love, no time to please the Lord above. No time to quieten down our pace, no time to serve or win his grace, no time to smell roses on the way, no time to pause or think or pray. This frantic life grips us in a vice, and each one of us will pay the price for ignoring the quest of who am I? God put me here, but tell me why. And so many lives lived full of pain, no lessons are learned, no bliss to gain. And this goes on till we hear the call, O Lord, make me love all, serve all. Only in serving all shall I realize that peace of mind, a precious prize, that joy and sorrow are but the same, that all of life is just a game, that all I see is part of me and it will remain for eternity. Sacred and divine is our state. Lord Sai has come to open the gate. Pass through, my love, for you are free. Witness your own reality. Life and death shall hold no sway. Body and mind shall melt away. They were but embodiments of love, pure and white, innocent as a dove. given to you to reach this goal. Becoming was not, being is whole. We are human beings. Let's be. Let's learn to be. So walking on the sands of time, I may have left a few footprints, and they will be washed away as the tide changes, and I'm sure others will be there. Along this journey has been my sweetheart and my wife, Iti Itinder Kaur, and we really are very blessed to have had the opportunity to serve and love those all around us. Thank you.